HIV Case Presentation by Group 1.
This is the Calvario family. They live harmoniously in their family home in Apayao since the parents got married and started their own family. Both parents are very close to the children while growing up. The children look out for each other when they are still living together in their home. The family belongs to the launching family stage of the family life cycle. According to structure, their family is considered a nuclear family because only the parents and their children live in their house. As to naming, their family is patronymic in nature since the family takes the father's family name. With regards to residence, the family is classified under neolocal for they live in a new residence instead of with the father's family or the mother's location. According to authority as patriarchal, the head of the family is the father. The authority and decision in the family is vested in him. Armando Calvario Jr., the head of the family, 67 years old, a retired general, apparently healthy and engages in running and golf as his form of exercise. He wants his only son to carry on his legacy of their family name. Delilah Calvario, the light of the family, 62 years old, a retired high school teacher, a known hypertensive, but is compliant with her medications. She is very active in participating in the church's activities during her free time. The couple has three children. The eldest daughter, Mariposa Cabalen, 30 years old, married, works as a nurse, and lives with her husband and two children beside their family home in Apayao. Ernesto Calvario, our index patient, the second and only male child, he is 28 years old, single, works as a call center agent in Valenzuela City, and lives alone in a room for rent near his workplace. And lastly, Princess Calvario, the youngest daughter and the confidant of our index patient since high school, is 26 years old, single, an accountant, and lives with her parents. Back in high school, Ernesto felt attracted to one of his male friends and decided to keep it to himself for a while. Princess, however, noticed his brother getting uncomfortable whenever he was around that certain friend, so she asked him what was wrong with them. Ernesto admitted to Princess that he is gay and he likes his male friend. He begged his sister not to tell anyone, especially their father, because he is afraid that their father might get disappointed. When Ernesto went to college in Manila, he became more open to being gay and met a lot of gay friends who encouraged him to try a homosexual relationship. He had a boyfriend for 2 years and became sexually active since then. Ernesto got bored with the relationship and eventually broke up with his boyfriend. He became curious and decided to try to have casual hookups with men when he goes clubbing with friends during weekends. Pleased with the thrill and enjoyment of casual hookups, he continued it through college and board review whenever he got stressed with studying. Ernesto failed his board exam and this left him very stressed and devastated. To be able to cope up with this, he started using dating apps and resumed having casual hookups with his matches for several months after the board exam. He later decided to look for any job that could help him finance himself because he was so ashamed to go home or ask for financial support from his parents. He found several jobs but was not able to stay long because he did not enjoy doing them until one day he got accepted in a call center agency and found his calling there. He worked hard and was eventually promoted to being a training supervisor 2 years later. He lived a promiscuous lifestyle since then. 2 months prior to consultation, Ernesto noticed that he was always feeling lazy, sleepy, and sluggish, so he opted to go to the gym and increase his caffeine intake to boost his energy. 4 weeks prior to consult, he was still lethargic, but is now accompanied with muscle and joint pains. Skin rashes also appeared on his back. He did not take any medications nor sought consultation. 3 weeks prior to consult, he still experienced the above-mentioned symptoms, but now with skin rashes on his chest. He also noticed that he is losing weight despite eating a lot and performing weight gain exercises at the gym. He did not take any medications nor sought consultation. 2 weeks prior to consult, he noticed that his lymph nodes on his submandibular, post-auricular, and axillary area were swollen and enlarged. He also complained of sore throat but did not take any medications nor sought consultation. Few hours prior to consult, due to the persistence of symptoms, this prompted him to seek consult at Fatima University Medical Center. He was admitted and underwent several laboratory tests to diagnose his disease. Ernesto was admitted after his thorough consultation and underwent laboratory tests like Western blood tests and ELISA. He was put under observation for several days. Ernesto informed his younger sister that he was admitted but did not tell her why. The family immediately went to Manila to see him. As they were greeting each other, the results came up positive for AIDS. Ernesto was then advised to see an infectious disease specialist to further confirm his diagnosis. The doctor informed Ernesto that he is indeed HIV positive and that he needs to undergo treatment immediately to slow down the progression of the disease since he is still young and active. From that moment, Ernesto was in denial. He didn't know what to do, nor how he would open up to his family since he knows that this will surely break his parents' hearts, knowing the expectation his father has from him and his mother as an active church member. This will surely strain his relationship with them. The family talked about the whole situation calmly, and Ernesto thoroughly explained to them the whole scenario. The whole family was worried, yet they tried to be strong for Ernesto and decided that they have to take him home to Apayao to continue his treatment there, so that they will all be together for each other. Ernesto was advised to request for a leave of absence for a while so that he could concentrate on his treatment and will be back on his feet in no time. Ernesto was advised to take one tablet a day 2 to 3 hours after meals of an ART regimen made up of 3 antiretroviral drugs: tenofovir 300 mg, lamivudine 300 mg, and efavirenz 400 mg. After taking these drugs, Ernesto may experience dizziness, vivid dreams, warm feelings, muscle wasting, and fat redistribution. To prevent the infection, Ernesto was advised to take ascorbic acid 500 mg once a day, multivitamins 1 tablet once a day after meal. He was also advised not to eat raw or uncooked meals, avoid crowded places, and always wear a mask to protect himself on the current pandemic. For the counseling, Ernesto was advised to request for a leave of absence from work and be with his family in Apayao for support during his treatment and recovery. He sought help and treatment from the nearest DOH HIV treatment hub from Apayao, Baguio General Hospital and Medical Center. He was advised to take his CD4 count and viral load checked every 2 months until they are back to normal, then check every 6 months for monitoring. Maintain his health to achieve optimum level by quitting smoking and drinking alcoholic beverages, daily exercise, eat nutritious food, and abstinence from sex. And lastly, Ernesto was advised for follow-up or to seek consult to private doctor if he is feeling untoward signs and symptoms like fever, difficulty of breathing, and loss of consciousness.